this is a question that's been asked a lot lately is basically, how do you know when your hormone therapy is right? And how do you know when to make adjustments and what are the right levels? And again, it's individualized, but let me do my best at sort of thinking through how can we generalize this to make some sort of sense of something. So I have this motto when I think about hormone therapy. I always think to myself, I want my patients to feel 70 to 80% better at minimum. If we get you to feeling 95% better, it's probably not just the hormone therapy. It's just that life is great, but 70 to 80% better with limited side effects or no side effects. And for most of my patients, that tends to fall in an estrogen level, if we're going to check in the blood, somewhere between 40 and 70, sometimes less, sometimes a little bit more. There's no hard and fast rule, and I usually don't use labs necessarily to guide me. I really use what my patients are saying. So I'm looking for the hot flashes are mostly gone, I'm sleeping again, I'm not having any bleeding or breast tenderness. Got it. That's how I know you're probably in the right zone. It's doing its job and you're feeling good. The other thing I think about is it has to fit into your lifestyle. So some women are given the patch, but they forget to change it. It's like, oh gosh, day 4, oh my gosh. Or they're given the gel, but their dog's coming up and licking them, so they never put it on anymore. There's so many fun stories I get to hear. And so it has to fit into your lifestyle, has to make sense for you, and you have to feel really confident about it. Because I always say, the biggest risks of hormone therapy are not the scary things like breast cancer and starts. It's actually probably bleeding, breast tenderness, and then your mom telling me that I'm trying to kill you. And so as long as you feel confident about your HRT, it fits into your lifestyle, and you feel really well on it, you're going to do great. And so we make adjustments every, 6 to 8 to 10 weeks until they start to feel really good. And so a lot of times once we find your right dosage, we can kind of sail like that for a while. But interestingly, a lot of my patients are finding sometimes things need to be tweaked and changed. We're using different hormones now, like a lot of GLP-1s, and GLP-1s, which are another hormone, might mean we need a little bit of a tweak in our hormone therapy. But what's really nice and what we love to do with our patients is really kind of find I'd call a base formula for you. What's the formulation or the routes of the hormone therapy that you like? And then my patients kind of almost start to learn. They're like, I think it's too low. I think it's too high. And, we kind of can make little tweaks over time. But oftentimes the biggest challenge is that first probably 6 months or so. It can take a little bit of time to kind of find the right, I always call it Rubik's Cube, find the right couple of clicks, and then you've really found something that you like, and then we make adjustments from there.